Hi, it's Dr. Andrew Y. Silverman, MD, PhD. I've been offering gender selection for approximately 25 years now. More recently, I've combined the G-SMART method, as I've called it, with in vitro fertilization, and the combined technology is called the Silverman method, which increases both the success rate of conceiving and specifically having a child of the sex that you wish. For that reason, I've seen couples from all over the world who sought me out as far away as Australia and the EUA so that they can have a child of the sex that they want. I initially did my training in Montreal in obstetrics and gynecology, and then moved with my family to San Antonio, Texas, and joined the Department of Reproductive Medicine there. I did completed training in reproductive medicine and then left for private practice. But I always had an interest in reproduction, even well before my training began. And when patients came to me and said, "Look, Dr. Silverman, you've helped us have a boy or a girl. We'd like to complete our family and have a child of the opposite sex." So that's when I read up on and started practicing initially to help couples conceive their next child of the sex of their own choice. When I began to offer gender selection, I contacted Dr. Ronald Erickson, who was in California at the time, who had patented the technique that he developed on selecting a child of the sex of your choice. And he agreed to come to New York. I had to pay his way here. And when he arrived, he said, "Well, I need about 10 semen samples in the next 2 days." I looked at him and I said, "You got to be kidding me. I can't do that." And then it just so happened my wife, who's an interior designer, had a bunch of Portuguese painters around at the time. So I brought them all into the room and I said, "Okay, guys, I have a deal for you, but I'm going to pay you for it." So they agreed. And over the next 48 hours or so, I worked with Dr. Erickson on the samples they provided. And Friday afternoon, before they left and they were getting paid, they said to me, "Okay, who's the macho?" I said, "What are you talking about?" They said, "Who's the best of the lot?" And I said, "Oh, this guy." And they all cheered and clapped and they took him out for beers. And that was my first learning and training in gender selection. When I first started gender selection, I had an office in Manhattan at a clinic, and I saw my own patients there. And the success rates that I was achieving initially were a little bit higher for a girl. And I called Dr. Erickson about it because I was a little concerned that I wasn't getting the 70 to 75% from males. And he told me, "You just haven't done enough cases." So as my caseload increased for those couples that wanted a boy, it came back to the 75%, which I would expect. More recently, in the last 4 years or so, I've been combining gender separation of the sperm prior to fertilization of the egg in an in vitro case. And I found that the data is trending very clearly toward that ideal 70-75% success rate of selection of the sex of the child that they want. And the advantage of that is that you don't have a lot of embryos that won't be used because they're the wrong sex. I have been performing gender selection for over 25 years. My staff and myself are both warm and caring, and will do our utmost to help you have your dream of a child of the chosen gender.